We'll talk about a very important hormone in pregnancy, and we'll try to establish, how these hormone levels kind of like increase in pregnancy and how it comes down in pregnancy. Of course, this now forms a basis of you trying to like track the progress of pregnancy to see how well things are going. So this is the human chorionic gonadotropin. Now let's talk about the application of the HCG in pregnancy. So you can see that this E is what? Estrogen, this P is what? Progesterone. But we're actually trying to focus on what? The human chorionic gonadotropin for now. So first, as a way of introducing it, is a hormone produced by the placenta. Do you understand? So as the placenta develops, fits into the mom, alright, connects, not really, the baby still developing though, but you just know that straight away the placenta starts producing this hormone, right? So it's often called the pregnancy hormone. It's a key marker. If you are doing any pregnancy test, this is what you're actually trying to look out for. Okay, so this is kind of like talking about the different weeks of pregnancy and the values, right? But I think this is much more in depth, this one. So here you can see that here is just trying to talk about the age of the pregnancy and the amount of human chorionic gonadotropin. Now of course the amount is measured in what? Alright, MIU stroke milliliter. Alright, so from week 4, week 5, week 6, week 7, 8 to 12, 13 to 16, 16 to 29, 29 to 41. So you might be a student watching this, you just want to cram up the values for your exam, or you might actually be a pregnant person. So as you're a pregnant person, they give you kind of like a test and they wrote the amount. So you can actually use this to actually interpret what is on your paper. Or if you're a student, you can use this for your exam, So it is measured by trying to identify two key components. So you are trying to actually dictate the presence. First of all, you are trying to establish that okay, this thing is here. Okay, then quantitative, you are trying to now say okay, if this thing is here, how much of it is here. Okay, so that's just it. It starts very quick, just 6 to 12 days after pregnancy, like after conceptions, and from then the amount is doubling every 48. That's 2 days to 3 days. The amount is doubling. Okay, so if you have low human chorionic gonadotropin, may suggest that maybe there are other issues coming up, like ectopic pregnancy, miscarriage, or sometimes it's just simply incorrect dating. Okay, so high human chorionic gonadotropin suggests that maybe there's more than one baby. Okay, molar pregnancies or also incorrect dating could be there. Okay, so that's it for human chorionic gonadotropin as one of the signs of pregnancies.